Multiple sclerosis, MS drugs. Multiple sclerosis, MS, is a condition that damages nerve cells in your central nervous system, CNS. Your CNS is composed of your brain, spinal cord, and optic nerves. MS causes symptoms that gradually get worse, as well as symptoms that come on suddenly after a period of being controlled. This sudden appearance of symptoms is called a relapse. There's no cure for MS, and the damage it causes can't be reversed. However, certain medications can help you manage the condition. Condition management focuses on medication that can treat relapses, as well as modify the disease to reduce damage and disability. It also involves other drugs that treat the symptoms or complications of MS. Fast facts. The Food and Drug Administration, FDA, has approved the following drugs for the treatment of multiple sclerosis, MS, oral drugs: cladribine, Mavenclad, dimethyl fumarate, Tecfidera, diroximel fumarate, Vumerity, fingolimod, Gilenya, monomethyl fumarate, bafirtum, ozanimod, Zeposia, siponimod, Mayzent, teriflunomide, Aubagio. Injections: interferon beta-1A, Avonex, Rebif, interferon beta-1B, betaseron, Extavia, glatiramer acetate, Capaxin, Glatopa, peginterferon beta-1A, Plegridy. Infusions: alemtuzumab, Lemtrada, mitoxantrone hydrochloride, natalizumab, Tysabri, ocrelizumab, Ocrevus. Understanding disease-modifying therapies, DMTs. There are several types of DMTs that work to help change the course of MS. The length of treatment with these medications can range from a few months to years, depending on how effective the medications are for you. Your doctor may recommend switching between these drugs throughout the course of your treatment. This will depend on how effectively each drug manages your disease and how you tolerate the side effects. If you switch to a different DMT, your doctor will take note of whether you develop new lesions. Injections and infusions. The Food and Drug Administration, FDA, has approved 12 Siemens medications that are administered by injection or infusion. Interferon beta products. Injectable drugs include interferon beta-1A, Avonex, Rebif, peginterferon beta-1A, Plegridy, interferon beta-1B, betaseron, Extavia. They help modify relapsing remitting MS, RRMS, and secondary progressive MS, SPMS, in cases of active disease, that is, a relapse has occurred or new lesions have appeared on an MRI scan. They also treat clinically isolated syndrome, CIS, a one-off episode of neurological symptoms. CIS can progress to MS and is sometimes categorized as a type of MS. These drugs are made up of proteins that keep certain white blood cells, WBCs, from entering your brain and spinal cord. These WBCs are thought to damage the myelin that forms a protective coating over your nerve fibers. Therefore, preventing these WBCs from moving into your brain and spinal cord can help slow their damage and reduce the number of relapses you have. You inject these drugs yourself. Your healthcare provider will show you how to do this. The number of injections depends on the drug. Rebif, 3 times per week. Betaseron, every other day. Extavia, every other day. Avonex, once per week. Plegridy, every 2 weeks. Glatiramer acetate, Capaxin. Glatiramer acetate, Capaxin, is a manufactured substance that resembles a basic protein of natural myelin. It's thought to work by prompting the WBCs to attack the substance instead of the myelin cells. It's used to treat RRMS and SPMS in cases of active disease, that is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat CIS. You inject this drug yourself once per day or 3 times per week, depending on your dosage. Your healthcare provider will show you how. People who receive injections 3 times per week should ensure that at least 48 hours elapses between their injections. The FDA has also approved Glatopa, a generic form of Capaxin. Natalizumab, Tysabri. Natalizumab, Tysabri, is an antibody that may block damaged T lymphocytes from moving into your brain and spinal cord. It's used to treat RRMS and SPMS in cases of active disease, That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat cysts. A healthcare provider gives you this drug as an intravenous, IV, infusion. The infusion takes about an hour, and you'll get it every 4 weeks. Mitoxantrone hydrochloride. Mitoxantrone hydrochloride was originally used to treat cancer. Now it's also prescribed to treat people with MS. It suppresses the immune system cells that are thought to attack myelin cells. This medication is only available as a generic drug. It's used to treat SPMS or worsening RRMS in instances where other drugs haven't worked. It has a high risk of serious side effects, so it's only appropriate for people with these more severe forms of MS. A healthcare provider gives you this drug as a short IV infusion once every 3 months. The infusion should only take 5 to 15 minutes. Alemtuzumab, Lemtrada. Alemtuzumab, Lemtrada, is approved for people with relapsing forms of MS, including RRMS and active SPMS. It's intended for people who've tried at least 2 other MS medications but found that treatment was unsuccessful or caused intolerable side effects. It works by reducing the number of specific B and T lymphocytes in your body. This action may decrease the inflammation of and damage to nerve cells. Alemtuzumab is given as a 4-hour IV infusion. To start, you receive this drug once per day for 5 days. Then 12 months after your first treatment course, you receive it once per day for 3 more days. Ocrelizumab, Ocrevus. Ocrelizumab, Ocrevus, is the newest infusion treatment for MS. It was approved by the FDA in 2017. It's the first drug used to treat primary progressive MS, PPMS. It's also used to treat cysts and relapsing forms of MS. Ocrelizumab appears to work by targeting and ultimately reducing the number of B lymphocytes. B lymphocytes are responsible for damage and repair of the myelin sheath. Ocrelizumab is given as an IV infusion. To begin, you'll receive it in 2 300 mg, mg, infusions, separated by 2 weeks. After that, you'll receive it in 600 mg infusions every 6 months. You'll also receive a corticosteroid and an antihistamine on the day of each infusion to reduce the risk of reaction to the medication. Ofatumumab, Kesimpta. Ofatumumab, Kesimpta, was approved by the FDA in August 2020 and is the newest treatment for MS. It's used to treat RRMS and SPMS in cases of active disease. That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat cysts. Like ocrelizumab, Ocrevus, it also works by targeting harmful B lymphocytes and reducing their overall number. Ofatumumab is given as an injection once per week for the first 3 weeks. After a 1-week break, the drug is given as a monthly injection. Oral medications. The FDA has approved 8 oral medications for the treatment of MS. Fingolimod, Gilenya. Fingolimod, Gilenya, comes as an oral capsule that you take once per day. It was the first oral medication approved by the FDA to treat RRMS. It's also used to treat cysts and active SPMS. Fingolimod causes the damaging WBCs to remain within your lymph nodes. This reduces the chance that they'll enter your brain or spinal cord and cause damage. Teriflunomide, Aubagio. Teriflunomide, Aubagio, is an oral tablet that you take once per day. It's used to treat RRMS and SPMS in cases of active disease. That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat cysts. Teriflunomide works by blocking an enzyme that's needed by the damaging WBCs. As a result, teriflunomide helps decrease the number of these cells, which reduces the damage they can inflict. Dimethyl fumarate, Tecfidera. Dimethyl fumarate, Tecfidera, is an oral capsule that you take twice per day. It's used to treat RRMS and SPMS in cases of active disease. That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat cysts. The exact mechanism of this drug is unknown. It appears to work by interfering with the activity of certain immune system cells and chemicals to reduce the risk of MS relapse. It may also have antioxidant properties that help protect against brain and spinal cord damage. Monomethyl fumarate, bafustin. Monomethyl fumarate, bafustin, is an oral capsule that you take twice per day. It's the newest oral drug on the market, having been approved by the FDA in April 2020. It's used to treat RRMS and SPMS in cases of active disease. That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat CIS. Monomethyl fumarate is a bioequivalent of dimethyl fumarate, Tecfidera. Like dimethyl fumarate, monomethyl fumarate may have antioxidant properties and appears to work by interfering with the activity of certain immune system cells and chemicals. Cladribine, Mavenclad. Cladribine, Mavenclad, is a pill that you take for a total of 16 or 20 days over the course of 2 years. You'll have treatment for 2 weeks per year, with each one lasting 4 or 5 days. There's a 1-month break in between the 2 weeks of treatment. It's approved for people with relapsing forms of MS, including RRMS and active SPMS. It's intended for people who've tried at least one other MS medication but found that treatment was unsuccessful or caused intolerable side effects. It may work by reducing the number of harmful B and T lymphocytes that you have. Siponimod, Mayzent. Siponimod, Mayzent, is an oral tablet that you take once per day. It's used to treat RRMS and SPMS in cases of active disease. That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat CIS. It's believed to work by blocking certain inflammatory cells from leaving your lymph nodes. This action limits the amount of nerve damage that they can inflict. Diroximel fumarate, Vumerity. Diroximel fumarate, Vumerity, is an oral capsule that you take twice per day. It's used to treat RRMS and SPMS in cases of active disease. That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat CIS. Diroximel fumarate has the same active ingredient as dimethyl fumarate, Tecfidera, and it works the same way. This means that it may also have antioxidant properties and interfere with the activity of certain immune system cells and chemicals. Ozanimod, Zeposia. Ozanimod, Zeposia, is an oral capsule that you take once per day. It's used to treat RRMS and SPMS in cases of active disease. That is, a relapse has occurred or new lesions have appeared on an MRI scan. It can also treat CIS. It's believed to work by blocking immune cells from leaving your lymph nodes and entering your CNS. MS medications for children. Fingolimod, Gilenya, is currently the only DMT that's approved by the FDA for use in children. It's safe for use in people ages 10 years old and up. However, doctors may prescribe other DMTs off-label.